How does the neck age? Hi, I'm Dr. Kristina Tansavatdi and I'm a double board certified facial plastic surgeon. In this video, I'm going to share with you my experience of the aging process that I see in the neck. Most commonly, I see the neck aging before the face, and I want to share with you 3 patients of mine to show you what the neck looks like as the aging process progresses. And it's 3 different styles of aging because not every neck is the same. And I'm going to show you what happens in these 3 patients. These are the 3 most common ways I see the neck age. So first patient you'll see is she has very visible neck bands. I'm going to just draw out her neck bands here. These are what we call the platysmal bands. And when we see that, it's actually because the platysma, which is the muscle layer under the skin, is starting to become more hypertrophic, meaning it's very prominent, very strong, and sagging as well. So 2 processes that are happening with the muscle itself. So if we go along with her pictures, you can see that on the side view, it shows that she's lost that neck contour. She doesn't have that smooth, sharp jawline because the muscle's falling. And then also from an angled view, you can see those bands really, really strong in the neck. Now let's take a look at the anatomy. So I'm going to demonstrate with you on the drawing of a particular how the neck muscles are right under the skin. They're really under the surface of the skin. And I will draw here for you what happens is as the muscle sags, it starts to create a very visible band right in the front, okay? Falling as well as the front portion of the muscle being very strong creates that visible band. So what do I have to do for surgery to address that? Well, before surgery, it is I pre-treat the muscles with Botox. Yes, Botox. And that's because the muscles are very strong. So I want to diminish the movement before surgery so I can get a good lift. Then during the surgery, I do cut a portion of that muscle. So I shorten the muscle and then I lift the muscle up in a lateral direction, meaning up and out, so that the bands aren't falling. You want to take care of what's falling and lift it the other way. Some surgeons will tighten in the center. I've done that. I will tell you it's not the best way to address it. You can start to see those bands come back. But even then, even if you've gotten a great lift, the maintenance is very important in these patients when they have prominent platysmal bands, because what caused it in the first place is the muscle strong. So I recommend that my patients get Botox after surgery to maintain the results. And this is a picture of the anatomy on a patient, not on a patient, but just a demonstration, a depiction, and here is where those bands show up, right in the center as they fall down. And the tissues sag forward and down into the center. So what we want to do is lift up and out. All right, our next patient, this is what I call a wattle, a neck wattle. Some people come in and say, I don't like this center of my neck. I have a neck wattle. I can grasp it and it just feels like excess skin. And that's really what it is. It is excess skin. The muscles are falling, but the muscles are not strong. So you can see in this patient, she doesn't have bands in the neck. It's at rest. She doesn't have the bands, but you see on the side this loose skin hanging. And you can see on an angled view, right on this side view, how much it's hanging right there. You could just grab that skin. So what are we going to do in this case? In this case, the muscle and the skin are falling into the center and creating a central wattle right in the center here that I've just marked out on this depiction. So what I'm going to do is pull the muscles and pull them up and out and make sure that I also lift a good layer of the skin. So I have to lift the skin flap away from the muscle so I can tighten the muscle, but then whatever comes with the skin too, I'm going to lift that because it's a lot of excess skin. We call it skin redundancy. And that skin quality is not the same as the other patient that you saw previously. You saw bands in that neck, but the skin was good. In this case, the skin is not of good quality. It's thin. And so in those patients, my recommendation for maintenance afterwards is something that's going to tighten the skin further. That's an RF microneedling or some treatment on the skin to continue to tighten after surgery. So on this picture, again, I'm going to depict on the lateral approach, I'm releasing the platysma off the sternocleidomastoid muscle. It envelops over it. And now we're going to overlap and pull backwards to overlap more. So we're pulling laterally up and out, just like I did in the first patient. But in this case, maintenance afterwards includes skincare maintenance. All right, our last patient is what we call a heavy neck. That's when you have looseness from the skin that's starting to fall. You've got heaviness because of the fat that's starting to lose its collagen and also fall, and the muscles. All three layers, you're getting fat, skin, and muscle falling. So in this case, you could see on the angled view that really is a turkey gobbler, but you could see she has no neck contour, really no neck contour on the side. Loss of contour, and so how am I going to get that back? I actually have to contour as well as lift. What do I mean by that? So if you see in our anatomy photograph here, you will see that there's a fat pad right under the chin. We call that the submental fat pad that's sitting over the muscle, and we call it the pre-platysmal fat. So it means it's right in front of the muscle, and then there's fat that's deep to the muscle in the center that I'm outlined there on that anatomy picture. A good depiction is if the patient lifts their neck, you'll feel all the fat right in the center. This is all the fat that's sitting over the muscle. And then you can see also it goes all the way out to under the jawline so that you can see the patient didn't have a jawline. There's no contour there. So how am I going to get that jawline back? I actually have to lift the skin away. I do not like liposuction these patients. I actually like to sculpt directly. So under direct visualization, I see, lift the skin, remove all that fat, then I peel the muscle layers away. And so deep to that is the submental, subplatysmal fat pad. So there's a fat layering over the fat, over the muscle, and then deep to the muscle. So both of those layers I have to sculpt away. And once I do that, then I can see what's called the hyoid bone. The hyoid bone defines what's the beginning of the neck and the bottom of the chin. So the position of that hyoid bone is very important. So I'll show you in this picture here that this hyoid bone is sitting here high up in the neck. When I have a patient who has a hyoid bone that's low in the neck, it doesn't give a good neck contour. So in those patients, I'm going to tell them, I'm so sorry, I can't get quite the definition that you're looking for. But in patients who have a good hyoid position, but they just have a lot of fat, we just have to sculpt the fat out of those planes, and then we have to reposition the muscles back where we want them to be. The platysmal layer and the skin back up in a lateral up and out direction. So there you have it. Those are the three ways, the three patients I normally see for aging in the neck. It's a central neck wattle, where it's mostly loose skin, platysmal bands, where it's very prominent, and in both those cases, it's important for maintenance afterwards. And then the third case is a heavy neck, where everything is falling, and in that case, not only should they do maintenance for the platysmal bands with Botox, but also skincare maintenance as well. Thank you for tuning in. For more information on facelift and neck lift surgery, please tune to my channel at Facelift Expert.